Hello, my name is Troy Simmons, and this is my video on intervention presentation and reflection of Capstone practicum experience. The topic I focused on was the negative impacts of THC infused drugs like TCH gummies. The rise of TCH infused drugs, such as TCH gummies, is a social health problem that affects the young generation. In 2018, 43.5 billion people aged 12 years used marijuana, leading to increased TCH gummies use amongst young adults and adolescents. This project assessed a family member's experience with THC gummy and marijuana use from a leadership, collaboration, communication, and policy perspective. The background: the circulation of drugs in society has led to adverse effects on human beings. It has resulted in mental and physical health issues such as poor cognition and complications in the respiratory system, according to 40 2019. Drug abuse also results in impaired memory and increased changes of victims experiencing mental health disorders. While THC has been shown to have therapeutic benefits, it can also have adverse effects on health, such as increased heart rate, impaired coordination, and mental health issues like anxiety or psychosis, according to Kwame 2021. These negative effects may lead to increased visits to the emergency room or hospitalizations, which can result in higher healthcare costs. There is a need for more research on the effects of THC and its indications with other medications to help healthcare providers better understand the risks and benefits of THC and develop evidence based guidelines for the use. Current pharmacological treatment options for neuropathic pain offers only a few benefits, often with adverse reactions. Cannabis-based medicines have no clinically relevant benefit, and there is no evidence of publication bias. A broad search for studies suggests that a few people with neuropathic pain may benefit from long-term use. By selecting a cannabis strain with a higher ratio of CBD to THC, patients can experience the therapeutic benefits of cannabis while reducing the risks of negative side effects, according to Corey 2020. Intervention strategy: technology, care coordination, and community resources can help address the negative effects of THC gummies. Telehealth and mobile apps can be used to provide education, support, monitor symptoms, and educate patients about the drawbacks of substance abuse. Care coordination can be beneficial for patients transitioning from THC gummies to alternative treatments, providing comprehensive support and guidance while minimizing negative side effects safely. A study found that oral THC/CBD dosage on the healthcare professionals eliminated use other psychotic medications. Assessing community resources can also help patients manage symptoms and safely transition to alternative treatments like THC and CBD oral dosage, reducing feelings of isolation and stigma, making it an effective approach to overcome and prevent addiction. Motivation for change is essential in the treatment for drug use disorders. My patient learned to be aware of her environment and those around her, stay with reliable friends and family members, and recognize her limitations, remain active, learn to decline offers of drinks or drugs, and not to succumb to peer pressure. Objectives outline. My objectives are to build a trusting relationship with my essential for effective communication and collaboration. I will listen to my patient's concerns and provide her with empathy and respect. I will educate her on the risks and benefits of THC gummies, potential side effects, and risk factors. I will also provide her with clear and accurate information and involve her in decision making. This will help her feel empowered and respected. The most vital detail are those that the healthcare provider will provide ongoing support in the patient to monitor her progress and improve her outcomes, and suggest combining THC with CBD to mitigate the negative effects of THC gummies. Additionally, the healthcare provider will explain how this intervention can help reduce anxiety and other negative side effects associated with THC gummies. Obtaining input from the patient is essential to delivering high quality healthcare services, as it can help establish a trusting relationship between the patient and the healthcare provider, leading to overall better treatment adherence, improving health outcomes, and reducing healthcare costs. Assessing community resources can also help patients manage symptoms and safely transition to alternative treatments like the CBD and THC oral dose. This can reduce feelings of isolation and stigma, making it an effective approach for patients to overcome and prevent addiction and maintain pain and anxiety safely. Public health campaigns can help reduce negative effects by educating the public on the potential risks and harms associated with THC use, but campaigns that use fear-based messaging or stigmatize cannabis use can contribute to misinformation and harm reduction strategies that may not be evidence-based. The stigma associated with THC use can prevent individuals from seeking help or disclosing their use to healthcare providers, and individuals may be reluctant to engage with those services due to fear of judgment or discrimination, according to Reed 2020. Access to care coordination and community resources can be a barrier for individuals who live in remote or rural areas. Reflection of Capstone Practicum Experience. This capstone research helped me better comprehend THC as a nurse who recently began a new position in the emergency department and as an Army Reserve medic. The Capstone Practicum Experience was a wonderful experience to explore the negative effects of THC. The goal is for nurses to collaborate with other medical professionals to provide patient care, support, and engage patient education, screening, evaluation, usage of treatment options, programs, and harm reduction techniques. Most U.S. states has legalized marijuana, leading to an increase in harmful effects on the body. Nurses must promote evidence-based policies and positive change to enhance patient outcome. Local, state, and federal regulations influence nurses' role in influencing policies, enhancing patient outcomes, and lowering hospital readmission and avoiding sickness linked to THC-infused drugs. Challenges, describe challenges or obstacles. Getting my patient a specialist appointment sooner was one of the difficulties I faced. Moreover, a lack of understanding in proper labeling, the stigma associated with THC usage, and the fact that THC is more readily available in numerous products puts more individuals in danger. I will keep looking for more information and training to help me overcome these obstacles, and I will fight for more funding and support for THC evaluations and care. Achievements. The THC Capstone Project Assessment has produced positive results for me, such as I have a better understanding of THC related symptom management, a decrease in the frequency or severity of cannabis related side effects. It improved my understanding of the potential risks and benefits of cannabis use. It improved my decision making regarding its use and creation of a personalized care plan. Additionally, the participant gained awareness of the possible hazards, advantages of cannabis use in various demographics, being familiar with various cannabis products, example THC infused gummies, and has a better overall knowledge about local, state, and federal marijuana regulations. Lessons learned. As a nurse, it is important to build a trusting relationship with patients who use THC products. To do this, the nurse will actively listen to their concerns and provide empathy and respect. After establishing a trusting relationship, the nurse will educate them about the risks and benefits of THC, potential side effects, and risk factors. Contribution of intervention to the patient family satisfaction and quality of life. The interventions example brochures, educational research, doctor's appointments, and digital technology can help improve patient and family knowledge and understanding of THC. This will reduce stigma, promote safe and responsible use, and address specific symptoms or conditions related to THC use. Furthermore, these interventions can lead to improved satisfaction and quality of life, reducing anxiety and uncertainty about THC use, improving communication between patients, family, and healthcare providers, and reducing the likelihood of negative side effects or complication. Lastly, the intervention can address symptoms or conditions related to THC use and improve overall comfort and well-being. Leverage healthcare technology in my capstone project. Healthcare technology can be leveraged to improve outcomes of communication related to THC. Patient portals, mobile applications, telehealth, EHR, and social media can all be used to provide patients with access of information about THC and to connect with peers and healthcare providers that support and education. Patient portals can provide patients with access to information about THC, including dosing instructions, potential side effects, and interaction with other medication. Mobile applications can track THC use, monitor symptoms, and provide reminders for medication dosing. Electronic health records, EHRs, can be used to track THC use and monitor patients' outcome, allowing healthcare providers to make informed treatment decisions. Social media can be used to provide patients with access to information about THC and to connect with peers and healthcare providers for support and education. Digital devices such as medication apps, cognitive training apps, breathing apps, relaxation apps, and fitness trackers can all help to promote relaxation, reduce anxiety, and enhance cognitive function. Fitness trackers can track physical activity levels and provide reminders to move and exercise. Mindfulness and medication based apps have become increasingly popular, with Headspace being the most popular, according to Begin 2022. Patient symptoms and progress as they transition from TCH gummies to CBD therapy, providing reminders to take medication and monitoring side effects. Existing literature has shown that telehealth usage has also helped educate patients about the drawbacks of substance abuse. How health policy influence the planning and implementations of your capstone project. My THC project contributes to policy development by informing public health contributions, addressing patients and provider perspectives, and generating new evidence and research related to TCH use in healthcare. Marijuana has become one of the most fast growing industries in the United States, with the legal market projected to 22 billion by 2020. Policy makers should consider the potential benefits and risks of various policies to develop evidence-based approach that prioritize patient safety and well-being. State legislation can significantly impact the scope of nursing practice related to THC, as state can regulate the use and distribution of medical marijuana and other THC-based medication. Nurses' role in policy making, improving patient outcome, reducing hospital readmissions, and preventing illness associated with illicit drug use is often unsure of how to handle conflicting state and federal policies when it comes to allowing cannabis inside the acute setting, according to Ryan 2021. The outcome of my project. My capstone project related to the negative effects of THC has the potential to produce positive outcomes, such as improved patient outcomes, increased patient satisfaction, enhanced provider knowledge and skills, increased public awareness and education, and policy practice changes. This project aimed to improve understanding of the health effects of THC use, medical treatment, regulate cannabis use, and improve public education. It also addressed barriers nurses' role in evidence-based policies and positive change. In the research, negative effects of THC can help us better understand how cannabis affects physical and mental health, develop new therapy uses for cannabis, regulate cannabis use, and improve public education. THC has shown to have medical benefits such as pain relief. Research into the negative effects of THC can identify therapeutic uses, regulate the use, and improve public education. My capstone project outcome did not completely match my initial predictions because of numerous factors. Research and data, implementation strategies, external factors, and unforeseen circumstances are all factors that influence the outcome of my capstone project. Research and data produced outcomes matching some initial predictions, but some research data is incomplete, which caused outcomes to differ from initial predictions. External factors influence my changes in law, regulation, and market conditions, while other circumstances impact the implementations of THC. THC use should be continuously monitored and evaluated to ensure that it is on track to achieve the desired outcome and adjust necessary to ensure success. Overall, my initial predictions may not have matched the outcomes, but I remain flexible and adaptive in response to changes and other circumstances. I plan to present my THC project at the hospital and monitor and evaluate it to ensure success and adjust as necessary. Personal and professional growth throughout my capstone project and RN to BSN program. All of my projects and assignments were enjoyable, and I learned that from root cause analysis, making videos, PowerPoint presentation, speaker notes, conducting interviews. I was molded by my achievements and accomplishments on every assignment I completed. From the beginning of my RN to BSN program, which I started last August 2022, until the present capstone project. I gained a deep understanding of the effects of THC, research methodologies, critical thinking skills, and the ability to analyze and interpret data. Due to my family members' involvement, this subject was important to me, and now I'm more passionate about educating others in the community. Also, the RN to BSN program gave me the opportunity to explore new healthcare areas, gain exposure to different patient populations, and develop a deeper understanding of healthcare policies and practices. Overall, the combination of the capstone project And the RN to BSN program at Capella has enabled me to take my personal, professional growth to the next level. Going forward, I'm encouraged to pursue more opportunities for growth and development, such as continuing my education for a master's degree, networking, and being mentored. Thank you.